There's a mineral running more than 300 processes in your body right now, and most people aren't getting enough of it. I'm Dr. Elizabeth Miller, naturopathic doctor, and today we're answering one of the most searched questions online. What does magnesium actually do in the body, and why should you care? And stay until the end because one of magnesium's roles is something many people have never heard about, and it may help explain symptoms like hives, migraines, and chronic inflammation. But first, let's talk about something most people never learned in school. Magnesium is required for your body to actually use energy. Magnesium is an essential mineral, which means your body can't make it on its own. You have to either get it from food or supplements. It acts as a cofactor in more than 300 enzyme reactions in the body. So think of enzymes as tiny little workers in your cells. Magnesium helps many of those workers actually do their job better. So without enough magnesium, processes like energy production, nerve signaling, blood sugar regulation, and hormone balance just simply don't run efficiently. So let's walk through some of the most important systems that magnesium supports. The first being our energy production. Every cell in our body runs on a molecule called ATP, which is essentially our body's energy currency. But here's something many people don't realize is that ATP is only biologically active when it's bound to magnesium. So without magnesium, your cells can't properly use energy. This is one reason why low magnesium can show up as fatigue, muscle weakness, and poor recovery. In my clinical practice, this is something I actually see fairly often. So if somebody's feeling exhausted, despite sleeping well and eating well, magnesium is something I always consider. One of the most noticeable places magnesium works is the nervous system. Magnesium helps regulate GABA, your calming neurotransmitter, your NMDA receptors, which influence your brain's excitability, and it influences the activity of the sympathetic nervous system, which is our stress response. So in simple terms, magnesium helps prevent your nervous system from being in constant overdrive. Low magnesium levels have been associated with anxiety, migraines, poor stress tolerance, and sleep disruption. And clinically, this often shows up with people feeling tired but wired. Because magnesium helps regulate nerve signaling, it also plays an important role in muscle relaxation. So when magnesium is low, muscles can become more excited, which may lead to twitching, cramping, and restless legs. In my clinical practice, I often see improvement in patients who deal with restless leg symptoms when magnesium status is optimized. For sleep, magnesium may also help by supporting melatonin regulation, calming down nighttime NMDA receptor activity, and again, reducing that wired but tired state. So it's not a sedative, but it helps restore the healthy nervous system regulation. Magnesium also plays a major role in cardiovascular health. It helps regulate our heart's rhythm, our blood vessel tone, and our blood pressure. Here's an interesting mechanism. Magnesium acts as a natural calcium channel blocker, meaning it helps our blood vessels relax. Higher magnesium intake has been associated with a lower risk of hypertension, and clinical studies show that magnesium supplementation can modestly reduce our blood pressure. Low magnesium levels have also been linked to an increased risk of cardiac arrhythmias, and magnesium is even used in hospital settings to help stabilize certain abnormal heart rhythms. Magnesium also plays an important role in our metabolic health. It supports our insulin signaling, our glucose transport into cells, and our pancreatic function. Low magnesium levels are actually quite common in people with insulin resistance as well as type 2 diabetes. Large population studies have found that people who consume more magnesium in their diets tend to have a lower risk of developing type 2 diabetes. Now, we do need to interpret that information carefully because magnesium is found in foods that are very healthy, like leafy greens, nuts, seeds, and legumes. So higher intake of these may also partially reflect an overall healthier diet. But I will say randomized clinical trials also show that magnesium supplementation on its own improves glucose sensitivity, insulin sensitivity, and insulin resistance. So magnesium itself does play a direct role on our metabolic health, and it can be a marker of our overall healthy metabolic function. Most people associate our bone health with just calcium. But here's something many people don't realize, that about 60% of the magnesium in your body is actually stored in your bones. So magnesium helps regulate our calcium transport, it activates vitamin D, and supports bone structure. Low magnesium intake has been associated with lower bone density and increased osteoporosis risk. So if somebody's taking calcium but not getting enough magnesium, they may be missing an important piece of the puzzle. Magnesium also plays an important regulatory role in our inflammation. Low magnesium status has been associated with a higher level of inflammatory markers like CRP and cytokines. And when magnesium is low, inflammatory signaling can become more amplified. So clinically, we often see lower magnesium levels in people with conditions like autoimmune disease, metabolic syndrome, cardiovascular disease, or chronic stress disorders. And this can become a vicious cycle because inflammation will increase magnesium loss, and then the low magnesium then worsens inflammation. So it's kind of a snowball effect. Magnesium isn't a standalone treatment for inflammatory disease, but it's often a foundational piece in supporting inflammatory balance. Magnesium also supports several hormone systems in the body. It helps regulate our insulin signaling, stress response and cortisol, our reproductive hormone balance, and our thyroid hormone regulation. Magnesium helps our liver metabolize estrogen, and it supports the energy-dependent processes involved in producing progesterone. It also helps support healthy testosterone levels, particularly by influencing sex hormone binding globulin and improving our metabolic health, which down the line will affect how much testosterone is biologically active in the body. So because of this, magnesium status can influence symptoms like PMS, mood swings, cycle irregularity, perimenopause symptoms, libido, and energy and physical performance. Magnesium doesn't act like a hormone itself, but instead it supports the systems that regulate our hormones. Now here's the part many people have never heard about. Magnesium appears to help stabilize mast cells, which are immune cells that release histamine. Low magnesium may contribute to increased mast cell activation, greater inflammatory signaling, and stress-triggered allergy or hive flares. So clinically, magnesium often becomes part of the conversation in patients dealing with chronic hives, histamine sensitivity, migraines, and stress-triggered inflammatory flares. Again, magnesium is not a replacement for treatment for allergies, but it's part of the support of the underlying terrain. Why are so many people low in magnesium? Magnesium depletion is actually quite common in modern life, and several factors contribute to this. The soil depletion can lower magnesium in our crops, processing foods strips the minerals, chronic stress can increase our urinary loss of magnesium, alcohol and caffeine can increase our secretion of it, heavy exercise and sweating will increase our requirements for magnesium. Certain medications like acid-reducing drugs like proton pump inhibitors or birth control pills, as well as chronic inflammation, will increase our utilization of magnesium. And there's another important thing to keep in mind, that most magnesium in the body is stored in our cells or our bones, not floating around in the bloodstream. So standard blood tests can appear normal even if somebody is functionally low. So what does magnesium actually do in the body? A lot of things. It powers your cells, regulates inflammation, calms your nervous system, supports hormone balance, stabilizes histamine activity, relaxes muscles, protects the heart, and it strengthens your bones. So magnesium is not a cure-all, but it's one of the most foundational minerals your body depends on every single day. If this video was helpful, make sure to subscribe, because in the next episode, we're going to talk about how to recognize magnesium deficiency, including the symptoms that I look for in my clinical practice. And if you've ever struggled with chronic fatigue, poor sleep, inflammation, PMS, or restless legs, you'll definitely want to watch that one. I'll see you in the next episode.